thank you so much for joining me once again. I'm Chelsea Moore for Divine Speech and Language Services, and today I want to talk to you about some very important information regarding ear infections and how they affect speech and language development. Now, the first thing I want you guys to realize is that a child that is an infant or a child that is a toddler has a very difficult time trying to let their parents know that they are uncomfortable, specifically from an ear infection. So there are a couple of things that you have to keep in mind. Number one, when a child typically has an ear infection, you'll see lots of pulling and tugging or perhaps digging in their ears. And this can be especially challenging for parents of girls because sometimes girls have just had their ears pierced as infants, and parents may misconstrue the fact that they see them pulling on their ears, but they think that they're messing with their earrings. So we have to be really careful and cognizant of how they move around their ears. You might see a lot of this, you might see a little bit of fussiness. Sometimes there'll be fever, fluid draining from the ear, uncomfortableness. Sometimes the child will stop responding to normal environmental sounds such as a dog barking or perhaps a very low sound such as a doorbell that may not be tuned really, really loud that she normally or typically responds to. Additionally, there could be some trouble responding in a quiet environment to her name if she typically turns when her name is called. And sometimes they'll even have a loss of appetite and difficulty with sleeping. So there are just some certain things that you'll see. Those particular physical attributes that I just told you about are some things that you'll see physically. Secondly, what you need to remember is that when you see all of those things, or at least 2 or 3 out of that whole list, then I will go ahead and head to the doctor. What ends up happening, for one, is that if they have a fever and they're younger than 6 months old, they probably need to see a physician. There could be a number of things going on, and ear infections could be one of them. Secondly, they'll also have increased pain. Again, you'll see that same fussiness we talked about, and sometimes you'll see the fluid coming down. But again, these are babies. Even 3 and 2 and 1 year olds, they cannot adequately and effectively express to you that they are uncomfortable. Now, here's the thing. Speech and hearing difficulties go hand in hand. Reason why? Number one, if there are lots of recurrent ear infections, it tends to alter the acuity of how they hear sounds. In other words, they don't hear sounds accurately. So if you cover your hands like this while I'm talking, you'll actually see my mouth moving while you're watching this video, but you may have very little clarity in terms of what I'm actually saying. Sometimes you'll see them even staring very intently into your mouth or kind of looking at your whole body as you talk, and then you might see a lot of this accompanying it as well. Those difficulties can affect overall speech development because now they are hearing the sounds either in a muffled fashion or they're mishearing the pronunciation of the sounds. Over time, that starts to amount to them learning the sounds appropriately, and they may not even respond to the sounds as we would expect them to, even basic sounds like P's, B's, M's, T's, D's, K's, and G's. Those sounds can be very difficult for them to come by because they're not quite sure what the appropriate pronunciation is. Over time, you might even see speech and language delays, including delays in babbling, delays in talking, delays in making specified sounds that they should be making by certain ages. And over time, if all of those things are not fixed, you might even see an articulation developmental delay or an articulation phonological process delay or disorder, meaning that their sounds are all mixed up and their speech intelligibility is incredibly difficult to understand. For more information regarding our services, please visit us online at divinespeech.com. And if those babies look like they have ear infections, they need to go to the doctor. Thank you so much.